Hello and welcome. Today we're diving into the world of urinary health to understand a common yet often uncomfortable condition, cystitis. We'll explore why it happens, why to recognize it, and what can be done to manage and prevent it. Let's get started. So, what causes cystitis? In most cases, it's a bacterial infection. Escherichia coli or E. coli is the usual suspect, accounting for the majority of infections. These bacteria normally live in the bowel and can travel up the urethra into the bladder. Other culprits include bacteria like Staphylococcus saprophyticus, Klebsiella, and Proteus. Less commonly, cystitis can be caused by non-infectious factors such as certain medications, radiation therapy, prolonged use of catheters, or irritating hygiene products. It can also occur as a complication of other health conditions. Let's talk about the how behind cystitis. When bacteria enter the bladder, they can adhere to the bladder wall. This triggers an inflammatory response. The bladder lining becomes irritated and inflamed, leading to the characteristic symptoms of cystitis. The inflammation also stimulates nerve endings in the bladder, creating the urge to urinate frequently and urgently. In severe cases, the infection can spread to the kidneys, leading to a more serious condition called pyelonephritis. Cystitis is incredibly common, especially among women. This is largely due to the shorter urethra in women, which makes it easier for bacteria to reach the bladder. Studies show that about half of all women will experience at least one episode of cystitis in their lifetime. While less frequent, men can also develop cystitis, often associated with underlying conditions such as an enlarged prostate or urinary obstruction. Children can also experience cystitis, often linked to anatomical abnormalities or poor hygiene. Now, let's discuss what to look for. The symptoms of cystitis can vary from mild to severe. Common signs include a frequent and urgent need to urinate, a burning sensation or pain during urination, cloudy or strong, smelling urine, pelvic discomfort or pressure, and sometimes, even blood in the urine. Some people may also experience lower abdominal pain or a low-grade fever. It's important to note that not everyone will experience all of these symptoms. How is cystitis diagnosed? Typically, your doctor will start with a review of your symptoms and medical history. A urine sample is then collected to check for the presence of bacteria, white blood cells, and red blood cells. This is called a urinalysis. In some cases, a urine culture may be performed to identify the specific type of bacteria causing the infection and determine the most effective antibiotic. For recurrent or complicated cases, your doctor may recommend further tests like cystoscopy, where a thin tube with a camera is used to visualize the inside of your bladder, or imaging studies to rule out any underlying structural abnormalities. Cystitis can be classified in a few ways. The most basic distinction is between uncomplicated and complicated cystitis. Uncomplicated cystitis typically occurs in healthy women with no underlying risk factors. Complicated cystitis refers to infections that occur in men, pregnant women, individuals with urinary tract abnormalities, or those with weakened immune systems. Cystitis can also be classified as acute, meaning it's a sudden and short-term infection, or recurrent, referring to repeated episodes of cystitis. The good news is that cystitis is often easily treated. The primary treatment is antibiotics to kill the bacteria causing the infection. Your doctor will prescribe an antibiotic based on the type of bacteria identified in the urine culture. It's crucial to complete the entire course of antibiotics, even if you start feeling better, to ensure the infection is completely eradicated. Pain relievers such as phenazopyridine can help alleviate the burning sensation during urination. Drinking plenty of fluids is also essential to help flush out the bacteria from the bladder. For non-infectious cystitis, treatment focuses on addressing the underlying cause. Prevention is key to minimizing your risk of cystitis. Some helpful strategies include drinking plenty of water, urinating frequently, especially after sexual activity, wiping from front to back after using the toilet, avoiding irritating feminine hygiene products, and considering cranberry products, although the evidence for their effectiveness is still debated. For women with recurrent cystitis, low-dose antibiotics or vaginal estrogen therapy may be considered. The prognosis for cystitis is generally excellent with prompt treatment. Most people experience a full recovery within a few days of starting antibiotics. However, recurrent cystitis can significantly impact quality of life. Recent research is focusing on alternative treatments, such as probiotics and D-mannose, to prevent recurrent infections and reduce antibiotic use. Scientists are also exploring the role of the bladder microbiome in preventing cystitis. These advances offer hope for improved management and prevention strategies in the future.